health. Data from the CDC reported by the Washington Post shows that boys and men are more likely to die earlier than girls and women.
According to the CDC, as of 2021, there is a record-breaking 5.9-year longevity gap between men and women. Researchers say that number could grow. Joining us now to tackle this is board-certified surgeon Dr. Cedrek McFadden. Dr. McFadden, good to have you with us. So let's jump right in and talk about why this is relevant. What are some of the stressors around the world right now that men could be facing contributing to all of this?
There's so many. And unfortunately, I see these even in my surgical practice where men come in, they're having signs and symptoms of depression, anxiety. It's either not recognized, it's disregarded, and it's going undiagnosed. And this leads to a propagation of other health problems. They're ignoring their health, they're not getting the help they need in a timely manner, not doing the recommended screenings, which then, of course, have really negative health consequences. And it's compounded. I mean, think about the violence that we see. Men are more likely to be victims of violent assaults, domestic violence. Men have higher rates of suicide. That all leads to that number. And we're seeing that across all age groups, boys, even down as infants. There's some data that shows that infants are dying, especially in males, greater than females.
And doctor, you just touched on this. Studies show that men are more likely to die by suicide than women. Why is that, and why are they less likely to seek treatment?
Well, I think about the stigma, right? And often in our culture, we tell men, suck it up, tough it out, shake it off. There's a stigma that's attached to, showing some vulnerability, showing that you need help. And as a result, people aren't talking. They're not talking to therapists. They're not talking to their loved ones. They're socially isolated. We're coming off of the pandemic where men were more likely to get COVID, to die of COVID, and to be more socially isolated. So it all compounds on itself. We have to speak up. We have to seek help.
Let's talk about some possible solutions here. What are the things that men can be doing to take better care of their mental health and their physical health and to improve their odds of living long?
Yeah, I think the big one is to find a doctor, right? And this is the big one, right? We have to have access, you have to be able to pay for it, but we have to find a doctor that we can talk to, that we can have dialogue just like this, so that people can break through some of the barriers, find the screenings and the help that they actually need. I think the other one that we have to remember is to take advantage of those screening opportunities that many of your insurance companies, your payers, they'll actually get you for very little cost, and then actually make sure that you're doing the things that your doctor tells you to do. Maintaining a healthy weight. We know that the higher your weight, the more likely you're to have diabetes, high blood pressure, high cholesterol, heart disease. These are high killers of men. And also limiting the use of alcohol. And if you're smoking, we've got to cut that out because that's always bad news.
We know there's a stigma when it comes to mental health, especially for men. Is there a stigma with physical health, too, of just going to the doctor and getting the tests you need to get done and all of that?
All right. I'm a colorectal surgeon.
Yeah.
All right. Of course, there's definitely a stigma. There's a barrier that comes up that men have to break through of seeking help, showing that vulnerability, walking through the door, and actually being okay with the exam to get them the help that they need.
All right. Dr. McFadden, thank you so much for your perspective and your expertise. We really appreciate it.